Hello and welcome to Module 1, Chapter 1. This presentation provides an overview of Module 1. This presentation is split into 4 parts. The first provides an overview of Module 1 and the 9 chapters in the module. The second provides an introduction to your trainers. The third provides advice on what to do next once you've reviewed this presentation. And the last provides information on how to get your questions answered. Let's look first at Module 1 and the 9 chapters in the module. In this course, you can learn about the Participatory Learning and Action Group approach for maternal and newborn health. It's called the PLA-MNH approach for short. PLA-MNH is an effective, low-cost, sustainable and scalable way of improving maternal and newborn health and reducing mortality. It works particularly well in rural areas where mortality rates are high and where access to services is low. The approach works by organising individuals concerned about maternal and newborn health to take collective concerns. This presentation is an overview of Module 1, which provides an introduction to the PLA-MNH group approach. In this introduction, you will hear a lot of terms related to PLA-MNH. Terms like groups, communities, meetings, members, problems, solutions. By the end of this module, you will have learnt how all these terms come together to form the PLA-MNH group approach. Module 1 is divided into 9 separate chapters. You are currently in Chapter 1, which will give you a brief overview of Module 1. Next, you will move to Chapter 2, where you will learn why PLA-MNH groups should be implemented in practice. In Chapter 3, you will learn about the evidence base behind the PLA-MNH group approach. In Chapter 4, you will learn about the mechanisms through which PLA-MNH groups work. In Chapter 5, you will learn where PLA-MNH groups should be implemented to ensure they have the greatest possible impact. In Chapter 6, you will learn who are the key beneficiaries of the PLA-MNH group approach. In Chapter 7, you will learn how PLA-MNH groups are implemented in practice. In Chapter 8, you will learn what resources are needed to implement PLA-MNH groups in practice. And Chapter 9 provides a summary of Module 1. Now, let's introduce you to your trainers. Your trainers are from Women and Children First. Women and Children First is a UK-based NGO working internationally to ensure that all women, children and adolescents can survive and thrive. Women and Children First develops and tests low-cost, community-based innovations that can support women, children and adolescents to overcome the challenges that can kill them, harm them and hold them back. Women and Children First's flagship innovation is the PLA-MNH approach. This has been rigorously tested and is ready for scale-up. Alongside this, Women and Children First is also incubating a number of other early-stage innovations. These are currently undergoing prototyping and testing. Women and Children First was established in 2001 by Professor Anthony Costello and his colleagues. Professor Costello is a former director of maternal and child health at WHO. Between 2002 and 2013, Women and Children First focused on designing and testing the PLA-MNH approach. This work was done in collaboration with the UCL Institute for Global Health. Together, these partners linked with local organisations in 4 countries and conducted 7 randomised control trials. In Nepal, 1 randomised control trial was conducted in collaboration with MIRA. In Bangladesh, 2 randomised control trials were conducted with the Diabetic Association of Bangladesh Perinatal Care Project. In India, 2 further trials were conducted with Ekjut and Sneha. And finally in Malawi, 2 final trials were conducted with My Mwana Project and My Kanda Project. These trials across the 4 countries established over 2,500 PLA groups and reached a population of almost 7.25 million people. Between 2005 and 2019, the evidence for PLA-MNH started to grow. The trials started to show how impactful it could be on maternal and newborn health and how it could help to reduce mortality. As a result, Women and Children First started to focus on supporting training and scale-up of the approach in new areas. This included supporting the scale-up of PLA in countries where it had previously been trialled. In Malawi, Women and Children First continued to collaborate with Mikanda Project to scale up to new districts, and also with new partners including Adventist Health Services. In Bangladesh, Women and Children First continued to work with the Diabetic Association of Bangladesh to scale up to new regions. Women and Children First also started working with new partners to scale up the approach into 9 new countries. This included working with Health Poverty Action to scale the approach into Latin America, specifically El Salvador, Guatemala, Honduras and Nicaragua. Women and Children First worked with the Well-Body Partnership in Sierra Leone to scale up the approach in Freetown, and also with UCL in the UK to scale up the approach into a borough of London. Women and Children First also collaborated with AMREF Health Africa and Doctors with Africa Coam to scale the approach into multiple districts in Uganda, and also with Doctors with Africa Coam and the Family Guidance Association of Ethiopia to scale the approach into regions in Ethiopia. Finally, Women and Children First also worked with Health Poverty Action to scale the approach in Myanmar. Through these scale-up activities, Women and Children First was able to support partners to establish 2,500 more PLA-MNH groups. These groups in turn reached a further population of 5 million people. Now, let's put some faces to the Women and Children First voices you'll be hearing during this course. I am Mikey Rosato, a PLA Master Trainer and CEO at Women and Children First. I have a BA and MA in Anthropology from the University of Cambridge, an MA in Psychology from the University of London, and a PhD in Global Health from University College London. I am fortunate to have almost 20 years' experience in the design, implementation and evaluation of the PLA-MNH group approach in 13 countries. My PhD was also on the PLA-MNH group approach. It explored the mechanisms through which the groups work. And what have I learnt from my PLA-MNH group experiences? Well, I've been lucky enough to visit several hundred groups and observe over 1,000 meetings. And the truth is that I've learnt far more from these PLA-MNH groups than I've ever taught them. But what strikes me every time I meet a new group is how similar they are, even across countries, but also how distinctively different they can be even within the same district. Although every group is guided by the same approach and has the same drive to address maternal and newborn health issues, every group is made up of a unique set of individuals, bringing together a diverse set of ideas that enables them to solve problems in innovative ways. Every group goes on the same journey, but takes a different path. And ultimately, that is the power of the approach: unique local solutions to common global health problems. I hope this also inspires you to go on and support PLA-MNH group in practice, and look forward to learning more about paths your groups take to improve maternal and newborn health and reduce mortality.
My name is Annemijn Sundal, and I'm a PLA Senior Trainer at Women and Children First. I have a bachelor's degree in public health at the VU University in the Netherlands, and a master's degree in global health and development at University College London in the UK. I've focused my career in global health and development on maternal and newborn health and community mobilization. My master's dissertation explored the sustainability of the PLA group approach in Nepal, and I led on the publication of this study in a peer-reviewed journal. My experience as technical officer and now programs manager at Women and Children First includes design, training, implementation, monitoring and evaluation of the PLA group approach. I have extensive experience of delivering multiple trainings to various audiences, such as government and NGO staff, as well as local implementation teams, both in the UK and abroad. Why do I value community? I strongly believe that stronger communities make a real difference to the people who live in them. Community is by definition a noun. It describes a collective of people. But through my experience of working with the PLA group approach, and wider community mobilization approaches, I have come to view it more as a verb. It is active, has motion, and impact. The PLA group approach enables a community to come together, work collaboratively towards a common goal, and realize impact as a result.
My name is Joanna Drazdewska, and I am a PLA senior trainer and head of programs at WCF. I have a bachelor's degree in international relations and a master's degree in development studies from SOAS, University of London. I have been working in global public health since 2011 with experience of both health systems strengthening and creating demand for sexual, reproductive, maternal and newborn health services in Africa and South Asia. My main focus now is community mobilization for better health by implementing, innovating, monitoring and evaluating and training in the PLA group approach. What PLA has taught me? What really convinces me about PLA groups, aside from the rigorous evidence behind them, is how they can make seemingly impossible goals possible. For example, when women from Malga, Ethiopia, tired of waiting for the government to build the promised maternity waiting home, took matters in their own hands. They made an action plan and presented it to the government. And together they cooperated to build the home. Or when teenagers in Oyam, Uganda, feeling empowered by their PLA group, spoke openly but respectfully to their parents, that they don't feel supported by them and how their support really matters to their health and well-being. Individually, most would not feel brave enough to take these steps, which an active PLA group made possible.
So, what should you do now that you have reviewed this presentation? First, we recommend that you update the Module 1 Progress Tracker. Second, we encourage you to go and do exercise 1.1 to help reinforce the learning from this chapter. If you have any questions, please don't hesitate to reach out to the Women and Children First team. You can email us or call us, and one of the team will be happy to help you. Enjoy the course.